All right, let's continue then with our discussion on HIV/AIDS. This week, the UN launched the World AIDS Day report titled "Let Communities Lead." For more on this now, let's speak to Eva Kiwango. She's the country's director for UNAids South Africa. Let me thank you so much for your time. One of the big things this evening that we've been talking about is this theme, and how interesting it is that it comes at a time when it does look like there needs to be much more, attention that is paid towards the community. Let's talk about the emphasis of this year.
Thank you very much, Bongiwe. And just to note that UNAids has just recently launched its World AIDS Day report that shows that the world can end AIDS if communities are included, not just at the decision-making tables, but leading, are funded and are supported. So much progress has been made over the last 40 years, and it's thanks to the efforts of community-based organizations. We know that they play a critical role in connecting people with services, especially those being left furthest behind. One cannot forget the tenacity and the resilience of civil society in South Africa in the late 90s and 2000s, and how that contributed to advancing antiretroviral treatment. Community advocacy from the streets to the courtrooms in South Africa to Parliament secured groundbreaking changes in HIV policy in this country. And today we have more than 5.6 million people receiving treatment because of communities. It is their fearless spirit, their courage and determination that has driven many of the successes. So in this World AIDS Day report, UNAIDS is celebrating communities as the heroes of our responses, and we're calling to action decision makers to fully support the life-saving work of communities and to clear the barriers that stand in their way.
And it definitely, is something that we were, talking about it from whether it's community-based care, whether it's what the community needs, listen more and get to hear some of what they need as opposed to a top-down approach. But there's a report that was, recently released by the HSRC, and it also paints a picture of some steady progress, that South Africa continues to make in this fight. And I wonder if the UN shares the same sentiments.
So the Human Sciences Research Council this week released the findings of the 6th National HIV Incidence, Prevalence, Behavior and Communication Survey. And let me start off by congratulating the HSRC, all of the implementers, the funders, and South Africa for showing up and taking part in this important survey. According to the findings, South Africa has a positive story to tell in its response to the pandemic. There are 7.8 million people living with HIV in South Africa in 2022. This number has not grown. And that means we're doing well in terms of reducing new infections, adding more people to the pool of people living with HIV. So that's an important finding. The survey also estimates that South Africa has achieved its treatment targets of 90, 90, 90. So 90% of people living with HIV are on treatment, 90% of those on treatment, 90% of those who know their status are on treatment, and 90% of those on treatment are virally suppressed. Now we need to push to get to 95, 95, 95 in the next 2 years. And these targets are within reach. We can get there. And I must say that results on viral load suppression are critical, especially in relation to new infections. If people's viral load is suppressed, it means they're not transmitting. However, there are concerns about this not being as low in the younger population. There are also concerns about children being left behind on treatment, as well as concerns related to the decline in condom use and the fact that only 50% of men have been circumcised medically.
And Eva, you know, these are some of the concerns. And I mean, this year we're seeing it in KwaZulu-Natal. And when one goes through that particular report, we're seeing the numbers of people that are living with HIV in the country is, you know, really just big. There's a huge portion there in KwaZulu-Natal. I was speaking to an expert on the show earlier on who was saying that the tap at the bottom is somewhat, you know, small, but at the top, it looks like it is, the bucket is open. The new infections are just coming in. How do we begin then to arrest that?
Let me just start off firstly by saying that South Africa has decreased the number of new infections by 50% since 2010. So that is an amazing achievement that needs to be acknowledged. Yes, it's correct. KZN remains the epicenter of the HIV response in South Africa. But according to the latest program data from the Department of Health, the Provincial Department of Health, KZN is at 97% of people living with HIV knowing their status. 86% of them are on treatment, and 93% are virally suppressed. So there is progress, and they're moving towards 95. And in some of the districts in this province have already achieved or are close to achieving the 95 targets, treatment targets. Just this afternoon, the Minister of Health, Honorable Joe Patla, was saying that of the top 15 districts in South Africa that are doing well in terms of treatment, 95, 9 to 10 of those districts are in this province. So the province has chosen the path to end AIDS. Strong political leadership, they're following the data, the science and the evidence, they're tackling inequalities, and they're enabling communities to lead, and they're putting sufficient funding behind it. What needs to be done is we need to increase treatment, we need to widen programs to prevent vertical transmission between parents and their children. We need to improve public knowledge and make prevention tools readily available. And the Sukuma Sake War Room, KZN, are addressing the inequalities, the issues around inequalities.
And just before we run out of time, let me stay with something you've just touched on, which I was going to, you know, go to, which is around children. How do we make sure that we don't leave them behind?
Yes, children are being left behind. You know, this country has 230,000 children under 15 years of age living with HIV, and 10,000 new infections among children every year. So sadly, South Africa has the largest HIV epidemic among children globally. And despite the scale of treatment in children since 2004, the proportion of children on treatment has remained unacceptably low. So South Africa's Global Alliance country plan, South Africa has joined the Global Alliance to end AIDS in children by 2030. And we're launching that initiative, the South African chapter, on World AIDS Day. The Deputy President will be launching that. And it prioritizes testing and starting on treatment the 72,000 children that are not on treatment, closing the treatment gap for pregnant and breastfeeding women. That's where a lot of new infections are happening, preventing new infections among these women, and addressing the structural barriers that hinder these women from accessing services, particularly gender-based violence. We are confident that with the launch of the South Africa chapter of the Global Alliance this Friday on World AIDS Day, we can close the treatment gap for children living with HIV so that they can lead the full and prosperous lives that they deserve.
Eva, I'm going to say something that I've been saying to all the guests as we've been talking about this subject tonight, that we want more, and certainly hope that we speak again, because these are important conversations, but as you put them succinctly for us, it also makes us not to feel despondent as South Africans, to say there's a lot to celebrate in this fight, to see how far we've come, and, you know, some of the wins, and really just build on that. But let me thank you so much. Do appreciate your time. That is Eva Kiwango. She's the country director for UNAids South Africa.